Esterified Estrogens Tablet is a hormone medication used by women to help reduce symptoms of menopause, such as hot flashes and vaginal dryness caused by the body making less estrogen. If you are using this medication for symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. This medication may also be used by women after menopause to prevent bone loss, osteoporosis. However, there are other medications that are also effective in preventing bone loss and may be safer. Certain estrogen products may also be used by men and women to treat certain types of prostate cancer, breast cancer that has spread to other parts of the body, and by women who are not able to produce enough estrogen. The daily dosage and optimal timing for taking Esterified Estrogens Tablet should be determined by your healthcare provider based on your specific condition and medical history. Before you start taking Esterified Estrogens Tablet, make sure to read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor. You can take it with or without food, but taking it with food or right after a meal can help prevent stomach upset. If you are taking the extended-release tablets, do not crush, chew, or dissolve them. Swallow the tablets whole to prevent releasing all of the drug at once, which can increase the risk of side effects. The dosage of Esterified Estrogens Tablet is based on your medical condition and how you respond to treatment. Take this medication regularly at the same times each day to get the most benefit from it. Do not increase your dose or take it more often or for a longer time than directed. If your condition does not improve or worsens, be sure to tell your doctor. Some common side effects of Esterified Estrogen Tablets include stomach upset, nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If you notice any of these effects lasting or worsening, be sure to inform your doctor or pharmacist right away. If you happen to see the tablet in your stool, it's important to let your doctor know promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. While many people using this medication do not experience serious side effects, it's still important to be aware of the possibility. If you do experience any serious side effects, such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, severe stomach pain, or swelling, it's crucial to contact your doctor right away. In rare cases, this medication may cause serious problems such as blood clots. Seek medical help immediately if you experience symptoms such as chest/jaw/left arm pain, sudden/severe headache, weakness on one side of the body, trouble speaking, or sudden vision changes. While a serious allergic reaction is rare, it's important to seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor or report side effects to Health Canada at 1-866-234-2345. Women who take estrogens, with or without progestin, may have an increased risk of cancer of the uterus, stroke, dementia, and serious blood clots. Taking a progestin as directed by your doctor can help decrease the risk of uterine cancer. It's important to talk to your doctor about the risks and benefits of hormone treatment. If you experience any unusual vaginal bleeding, be sure to inform your doctor right away. Estrogens should not be used to prevent heart disease or dementia. The risk for serious side effects may depend on the dose of estrogen and the length of time it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Be sure to discuss the use of this medication with your doctor and check with them regularly to see if you still need to take it. If you will be taking this medication long-term, you should have regular complete physical exams as directed by your doctor. Before taking Esterified Estrogens Tablet, it's important to let your doctor or pharmacist know if you have any allergies, or if you have a history of certain medical conditions. This medication should not be used during pregnancy or while breastfeeding. If you have concerns about using this medication, make sure to discuss them with your doctor. It's also important to be aware that smoking while using estrogens can increase the risk of certain health issues. Additionally, this medication may cause skin discoloration, so it's best to limit sun exposure and use sunscreen when outdoors. If you have any concerns about how this medication may affect your vision or the growth and development of your child, be sure to talk to your doctor. It's important to be aware of potential drug interactions when taking Esterified Estrogens Tablet. Certain medications may affect how this drug works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Esterified Estrogens Tablet include aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, this medication may interfere with certain lab tests, potentially leading to false results. It's important to inform lab personnel and all of your doctors that you are taking this drug. As for the benefits, daily dosage, and optimal timing of Esterified Estrogens Tablet, it's best to follow the instructions provided by your doctor. They will be able to determine the appropriate dosage for your specific needs and advise you on the optimal timing for taking this medication. If you or someone else has taken too much Esterified Estrogens Tablet and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of an overdose may include severe nausea or vomiting, as well as unusual vaginal bleeding. It's important not to share your Esterified Estrogens tablets with others. While taking this medication, it's important to have regular physical exams and medical tests to monitor your health. This may include blood pressure checks, breast exams, mammograms, pelvic exams, and pap smears. Be sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's also important to keep all medical and lab appointments and consult your doctor for more details. Taking Esterified Estrogens tablets can help to prevent or control high blood pressure, high cholesterol, and diabetes, which can reduce your chances of heart disease and stroke. Lifestyle changes such as reducing stress, eating a low-fat/salt diet, losing weight, exercising regularly, and stopping smoking can also help. It's important to keep your mind active with mental exercises, such as reading and solving crossword puzzles, to help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. If you experience hot flashes, lifestyle changes such as stopping smoking, dressing lightly or in layers, avoiding spicy foods, caffeine, and alcohol, reducing stress, and exercising regularly may help reduce them. To promote healthy bones, it's important to increase weight-bearing exercise, stop smoking, limit alcohol, and eat well-balanced meals that contain adequate calcium and vitamin D. You may also need to take calcium and vitamin D supplements, so consult your doctor for specific advice. If you forget to take a dose, take it when you remember. If it's almost time for your next dose, don't take the missed one. Just take your next dose at the usual time. Don't take 2 doses at once. It's important to store Esterified Estrogens tablets at room temperature, away from light and moisture. Avoid storing them in the bathroom and always keep them out of reach of children and pets. When it comes to discarding this medication, it's crucial not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, you should properly dispose of the product when it is expired or you no longer need it. If you're unsure about the best way to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.